Hey guys, again, it's Christopher South, and we are once again in the anatomy and physiology in the real world, talking a little bit about where things that you learn in an A&P course correlate with what's either going on the medical professional side or even in your own life. And today we're going to be talking about abdominal complaints. So, in this chapter that we're learning about the gastrointestinal system. But how many of you, at least at one time in your life, have had abdominal pain? All right. I know that sometimes you get it because it's something you ate, or sometimes it could be something a little more serious. And everybody's had those. And the big thing is your gastrointestinal system basically starts at your head, at your mouth, and goes all the way to your backside. And there is a lot of ground to cover, man, from the top to the bottom per se. And so with that, a lot of times people may get an upset stomach or whatever and think that it's nothing serious. But it may be that. It may be something that's completely not serious. It can be something as simple as gastritis, um, but it can be something a lot more complex. And so, in the emergency department where I work and on the ambulance, abdominal pain can be something that can be something that we really have to dive into and see what's going on. So let's talk about it just for half a second. Is think about, all right, when a patient comes into the emergency department complaining of abdominal pain, is it always something that's involving the gastrointestinal tract? Not always. And sometimes people kind of blow off those symptoms thinking that it's something quite simple, just thinking that it's something that they ate perchance, and ignoring the seriousness of something underlying that could be. For an example, you have a patient that comes in that's complaining of epigastric pain. So the epigastric region is just right above the diaphragm, kind of just below the center of the chest, kind of right at the very top of the abdominal crest there. And patients may have a history of GERD, which is like pain that's associated with the extra buildup of acid in their stomach. A lot of them take medicines like omeprazole and different things to try to combat that. And I think it's just GERD. However, it could be something more serious. A lot of times patients could be having problems with their heart. They could actually be having a heart attack and they could just blow it off and think that it's GERD, that it's something they ate, that they got an upset stomach. And what can mask some of those symptoms, what is a really common finding in patients who are having a myocardial infarction, is that abdominal pain, that fullness in their stomach, and they can also be experiencing nausea and vomiting with it. And so you may be thinking, well, that's gastrointestinal. However, it could absolutely be cardiovascular in nature. So some of the other things besides just the gastrointestinal thing that we need to be thinking about. So in any patient who is at childbearing age, all right, any lower quadrant or even upper quadrant abdominal pain could be a sign of something more serious that may be going on um, gynecologically. We've had patients that come in and they just got lower quadrant abdominal pain and everything, and we end up finding out that they could have something like um, they could have ovarian cyst. They could have an ectopic pregnancy, and all of those are very serious emergent complaints that we need to be taken care of. And so it may not always be gastrointestinal in nature. And so just because it's abdominal pain doesn't always mean that that's exactly what's going on. A lot of times that it is, and that's an encouraging finding. But it can absolutely be something serious. You can have a patient that comes in with a pain that's it's a tearing sensation. It goes from their belly all the way to their back, and so sometimes this can be as serious as having what's known as a triple A. All right, is where they have an aneurysm that's in the descending aorta that could be trying to rupture, and this is a very emergent situation. It could cause the death of the patient, and so think about it. It may not just be something that that patient ate, and it could be something much more serious. And so as patients come into the emergency department, we take those complaints serious of abdominal pain as we really go through and look at all of the things that it could be, besides something that may be causing them a little bit of stomach upset. Maybe they got a little bit of bad food from someplace. That's simple. We can fix that. We've got the medicines to be able to help that. But we always do our due diligence to make sure that we're looking all the other things that they could be. A lot of times when we have patients that come in with abdominal pain, we're going to do a 12-lead EKG. We're going to do all of our serum laboratory tests to make sure that everything's going on, not only metabolically, but we're also going to be looking for other serum markers, cardiac markers as well. And one of the things is we want to be able to see what's going on. All right, it's good that we can palpate and kind of feel around and see what's going on. We can see maybe a distended abdomen and things like that. But one of the things is we're definitely going to do studies on the. We're going to send them over to radiology, and a CT scan is one of the things we typically do in the abdomen to kind of see what's going on. We're looking for free air, fluid, seeing that all the organs are are in there, that they look correct and everything's functioning correctly. And we kind of go from there through all of the systems and everything. So, guys, if you think, hey, it's just something that I ate, it may be a little something more serious. So, if it doesn't clear up pretty quickly, you definitely need to go to the emergency department to be evaluated. So, I hope this helps to kind of clear up a little things about, hey, is it gastrointestinal or is it something more serious? And so, as providers, you guys are going through school and everything, learning about A&P, be thinking about, hey, the gastrointestinal tract is very long. It goes from the top to the bottom, and there's a lot of spaces in between, and so they kind of all intersect and everything. So next week, we're going to be in the emergency department again, and we are going to be talking with a few providers and nurses and everything, and talking about how we treat patients who come in with gastrointestinal complaints, and just actually want to walk through all the different processes through that, from the very beginning through triage all the way through to radiology, and even talking about like surgical options for some things. And so I hope you enjoy that, and hoping it gives you a little more insight on the reason why it's important to understand the gastrointestinal system, but also why it's important to understand those other systems and how they all work together, and how those complaints may not just be GI complaints, but they can also be underlying complaints from other systems. Hope this helps. Have a great day.